Chapter 7, Anticipatory Guidance for Expectant Parents. Because high dental caries rates occur in families, a child's tendency to develop caries can be in place long before the child is even born. Family members can pass their cariogenic oral flora to the infant at the time of the infant's initial oral flora colonization, and that is why we see the tendency passed from generation to generation. This is particularly true for mothers.
There's a 10 times greater likelihood that a mother who has high levels of strep mutans in her own mouth will transfer this germ to their child, to be differentiated from mothers who have a low level. So as a result of that, we want pregnant women to go to the dentist to get their own dental needs met, and to have optimum oral health so that they don't pass the germ that causes this disease to their own child.
We will now discuss the anticipatory guidance for families, particularly high-risk mothers, before and during the colonization process. First, begin or continue routine dental care to assure optimum oral health. Restoration of carious teeth is important to minimize infecting the infant with cariogenic oral flora.
If we do have dental care that needs to be done, we need to treat that, even in a pregnant woman, probably in the second trimester.
Daily toothbrushing and flossing are important to reduce bacterial biofilm levels. Also, dietary education is important and should include assessment of the caries potential in the diet, cariogenicity of certain foods and beverages, the role of eating frequently, and the process of demineralization and remineralization. The use of a fluoridated toothpaste approved by the American Dental Association is very important. Additionally, rinsing nightly with an alcohol-free over-the-counter mouth rinse containing 0.05% sodium fluoride can be beneficial. Parents, especially mothers, should be educated on methods to delay the colonization of cariogenic bacteria. Children who are colonized by mutant streptococcus by their second birthday will develop caries 90% of the time, whereas children who are not colonized by age 2 will develop caries only 25% of the time.
It's very important for you to make sure that you do not pass your germs, the bacteria in your mouth, onto the newborn infant. I'm sure you've seen some mothers that have taken a pacifier that fell on the floor, put it in their mouth to clean it off, and then pop it in the baby's mouth. That is not a good thing to do because the bacteria in your mouth gets transferred to the baby. So if we can make sure that you don't do that, if you're feeding the child and you want to taste the food, you take a lick of the spoon and then put it in the baby's mouth. Once again, those germs and the bacteria in your mouth are transferred to an infant that way.
Finally, evidence suggests that chewing xylitol gum 4 times per day had a significant impact on decreasing the caries rate of children of high-risk mothers.